And we're back on SpEd, and today we're talking with Dr. Andrea Walbrook, who is a clinical speech pathologist, and also the owner of Your Speech Therapy Solutions in the PG County, Maryland area. And we were talking in regards to as far as some of the different, as far as disorders in regards to speech pathology and language. One that's, from my understanding, is somewhat new in an aspect is childhood apraxia.
Yes.
It's usually been thought of it as just for an adults, but now it's going into as far as focusing on kids as well. Could you give us a little bit more information in regards to that?
And childhood apraxia is one of the areas that I think more parents are getting aware of as far as services. For example, apraxia is oral motor planning, how you produce sounds, not just like articulation. Articulation impairment is how you make the sound itself, but it's oral motor planning with apraxia. How do you plan to make these sounds, and how do sounds connect to make words? Apraxia is definitely, I should say, oral motor planning, how sounds like, for example, go together. For example, if it's a child is trying to produce a word, they might grope or their lips and mouth and musculature in this area might become a little bit more intense or tight because they're trying to figure out their mouth, how to make the sound. That groping and some of the oral motor planning, for example, making sounds p, t, k. If we gave a child with apraxia that type of task, they might go p, k, p, k, t, p. They can't put the order. The order of the process is out. So that is how childhood apraxia has impacted our community too with speech therapy services.
So if a parent wanted to work with a child who might have apraxia, as far as, could you just give us one tip that they might want to do in the home that'll help them along with helping them in the development of as far as creating these words appropriately?
I tell parents all the time, they're the first doctors, they're the first pediatricians, they're the first ones, they're on the front line. For example, early intervention for apraxia could be just playing word games, like even sound games like la, 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 playing patterns with your speech and playing patterns with the words. So that makes your oral musculature, as far as planning, letting neurons synapse, practicing that. So a lot of times I tell parents, play the word games, play the oral motor games like sound games, like patterns. Your turn, you try it. And if you have a child that's struggling connecting two sounds together at a certain age, you should have like a radar to say, I need to get in touch with a speech therapist.
Now, we touched briefly on stuttering. As far as if you have a child who has a speech impediment, like stuttering, what would be a tip that you would give a parent in order to work with that child?
Well, I think respecting that child as a communicator, and it might communicate differently. I think the wait time is what most people struggle with. Parents, teachers, educators, neighbors, friends. The other listener has to understand that person is trying to get their words out. So a lot of times people jump in and try to finish the sentence or finish the word, and that's not giving a respect to the communicator. So either they get frustrated, or they don't want to share, or they end up not sharing information because it's going to be corrected. So with fluency, I say give them that window of time.
There's also a new area that has developed from speech, and that's ACC. What does that actually stand for?
Well, augmentative alternative communication, or you say alternative augmentative communication, everybody says, we call it help. Help my child talk. Help my child communicate with me. So AAC has also been called help in a way that we say as speech therapists, because it gives children an opportunity to get information across either voice output device, which is called VOD, or they might have some type of alternative, an augmentative, where they might have picture symbols that represent things in their community or represent communicative acts they want to do, like requesting the bathroom, requesting for food, hunger, toileting assistance. So AAC is a powerful component of speech therapy. It gives a valid way and a valuable way for a communicator to communicate to others.
Now, what type of child would benefit from such a augmentative communication device?
Well, nonverbal. Usually, nonverbal has a concern for us as speech therapists. If a child needs help, if a person or adult or needs help to communicate a need of an emergency, a need, a want, how could they do that? I mean, and when you're nonverbal, that means no oral, audible is coming out as far as comprehension for the listener. So we need them to have that AAC.
Now, some parents might say, I want my kid to be vocal and nothing but vocals and verbalization. When should a parent start considering maybe another alternative like augmentative communication?
I think when there's a breakdown in the communication with an unfamiliar listener, like everybody, like mom, dad, grandpa, pop, they might know that the child says tat, tat, that means cat. Or they might go ka, they do the first letter sound. But when they go out in a broader community of communicative or communication community, I don't know you say the first letter sounds to everything. So your intelligibility is lowered. So when intelligibility is lowered to the point where it's a very low level of comprehension, I would really seek AAC as an opportunity for your communication.
And give us a brief definition of what intelligibility means.
Okay, the intelligibility in the speech therapy world is not equated to intelligence. Cognition, brain, neuro, synapse, and all of that's great, but intelligibility is how much do I understand as a listener of what you're saying to me. So it's the intelligibility of the speech statement, not just intelligence like a psychologist might give you a IQ score or cognition or your cognitive abilities.
What medical and developmental conditions could also benefit from speech therapy or language therapy?
We've had all sorts of children present now. When you say medical, you might have CP, cerebral palsy, you might have DS Down syndrome, you might have, we call it parents of Down syndrome that are now advocates, great advocates for getting opportunities for those children for communication and getting speech therapy. At one time, CP or cerebral palsy, people kind of put communication on the back burner because of the life expectancy or concerns about how much the communication factor was important. But communication is always important. That is always a valued act. So no matter what disability, what medical you present with, you want to be able to communicate. So it's a priority.
I also know that there's something called selective mutism. Mm-hmm. What does that mean?
And that's a phenomenon sometimes tied into some type of trauma at times. And then there's also some children that have had issues, let's say a type of trauma, and they've chosen not to talk. Or they have had early issues of some type of trauma that could have even been an accident. After a severe accident, we've had children that were injured in an accident, per se, and then came out, they weren't talking at all. Things have happened like with traumatic brain injury that are very similar to selective mutism in some ways and different in a lot. But selective mutism is truly choosing selectively not to communicate verbally.
Now, you talked about brain injury. I know there's something called right hemisphere brain injury. Mm-hmm. How is that different than a normal traumatic brain injury? Mm-hmm.
Traumatic brain injury can happen from a motorcycle accident, car accident, a fall. Traumatic brain injury deals with the total brain as a whole. It could happen anywhere. I mean, the assault or the impact can happen anywhere. As far as right hemisphere brain injury, in the right hemisphere of your brain, there are certain types of language events that take place. Also, when you see somebody that says they struggle from a stroke on the right side of their brain, right hemisphere, you're going to see some things happen on the left side of their body. It might be that they have some issues with motor, movement, speech, sounds, swallowing. All types of things can happen from an insult from the right hemisphere or the left.
When we come back, I want to talk a little bit about as far as what a parent should look for in a speech pathologist. And we'll do that right after this.